What brings you to the doctor's rooms today?
Actually, I had a fall a little while ago, and it's making me very sad because I cannot move the way I want to move. My leg is very sore, and it's making my life difficult. I can't get out of bed, and it's depressing me because I can't do what I used to do. And I think I need some help, if you could help me.
Okay, well, I think that we'll just start you on some medication. This pain medication should help you.
Hello, I'm back again, and I feel the medication hasn't helped very much, and I feel very down because I can't do what I want to do, and it's affecting my lifestyle, and so maybe there's something else you can give me.
Alright, I think we're just going to try this other pain medication for now,
Okay,
and we'll see how it goes.
okay, I will do that, and I hope it will help me. Thank you very much. And I think the doctor cannot give me anything more that would help me. So now I'm desperate, and I think I need some other help in a different direction.
Before the terms occupation and therapy were even coined together, there was something called the moral movement, which started at the beginning of the 18th century and introduced moral treatment instead of physical treatment for the mentally ill. The movement was started by Dr. Pinnell and Mr. Tuke, and this movement emphasized that all people are entitled to compassion. Thereafter, there was a psychiatrist named Adolf Meyer. Adolf Meyer realized that there were fundamental issues in the treatment of the mentally ill. These were the proper use of time, gratifying activity, and the influence of a positive environment. These developments and strong beliefs in the therapeutic value of occupations and activities led to the origin of the occupational therapy profession in psychiatric institutions. And lastly, we get to World War I and World War II, a difficult and cruel time for many. The first practitioners in the physical domain of occupational therapy started in 1910. These practitioners were called reconstructive aides and worked during World War I and II to rehabilitate disabled soldiers and civilian patients. They addressed the need of these soldiers for care beyond wound repair. The soldiers needed to have something useful to do and thus recapture purpose in their lives. Founders of OT, namely William Rush Dunton, Eleanor Clark Slagle, George Barton, Susan Johnson, and Thomas Kidner. George Barton is recognized as the person who coined the term occupational therapy. Thereafter, the National Society for the Promotion of Occupational Therapy was formed. This later became known as the American Occupational Therapy Association. Lastly, we have a prominent quote by Mary Riley, who stated, "Man, through the use of his hands as they are energized by mind and will, can influence the state of his own health." Thus, due to wartime experiences, occupational therapists have demonstrated the contribution they are able to make to the independence of people with disabilities. HPs may work in the primary, secondary, tertiary, or quaternary health sectors. However, there are certain national and international bodies that control occupational therapy. On an international level, there is the World Health Organization as well as the World Federation of Occupational Therapy. On a more national level, there is the Department of Health, the Health Professional Council of South Africa, and the Occupational Therapy Association of South Africa. These bodies regulate the behavior of health professionals. On a more specific level, the HPCSA is an extension of the rules of the Department of Health, and thus governs the behavior of health professionals, determines what is legally enforceable, and also determines what is allowed and not allowed within a professional capacity. The HPCSA installs core ethical values and standards for good practice.
As a healthcare practitioner, one must always keep a good relationship as well as a respectful one with their colleagues as well as with their patients. In addition, a healthcare professional also has a responsibility towards themselves, their patients, the community, their colleagues, as well as the statutory and professional body.